Namaskar once again. My name is Dr. Abhijit Dam and I am the President of the National Association of Palliative Care for Ayush and Integrative Medicine. And today we will be talking about clinical aromatherapy in palliative care. Over the years, we have seen that alternative therapies are on the rise. Use of complementary therapies are becoming increasingly popular because of many reasons, out of which one of the reasons is that they are inexpensive and second, they are easy to use. The National Center for Complementary and Alternative Medicine states that complementary therapies used in combination with conventional medicine successfully in long-term care to promote wellness and reduce symptoms associated with illness and disease. However, there is little scientific research to support the effectiveness and safety of these therapies. So, on one hand, we have complementary therapies which are increasing by leaps and bounds as a part of the holistic approach to medicine, but as far as the scientific research and scientific evidence needed to justify such approaches, those are not exactly matching up, right. That does not mean that complementary and alternative medicine therapies do not work. They definitely do work, but the scientific evidence is not exactly matching up currently. There are so many different types of complementary and alternative medicine therapies like music therapy, exercise, diet, massage, pet therapy, art therapy and aromatherapy, which is what we are discussing here today. Now, here this photo was taken in my hospice, which is in rural Jharkhand, and you can see this lady. She is a lady having advanced cervical cancer with multiple metastasis, and she was having a lot of spiritual distress, existential concerns she had. And you can see our team giving her a nice massage using a massage oil, which has been developed by a blend of different oils, different essential oils and with some base oil. And this massage therapy using these essential oils, and she used to get a lot of relief. She actually also suffered from insomnia, but after this massage she would happily go to sleep. She felt very secure and calmed down after this massage used to be given to her. So, this is an excellent example about how this complementary and alternative medicine and especially aromatherapy can be used, but replication of this same thing in that this patient is now going to sleep with this massage and aromatherapy. So, that every patient should do that, that will not always happen, because all humans are not the same. My mental makeup is different, your mental makeup could be different, your circumstances could be different, my suffering could be different. So, as we are all unique individuals, so we would all respond in our unique manner to a specific therapy, and that is where the research goes wrong. So, research wants a say yes or no pattern and nothing in between, but here you have lots of things happening in between. So, clinical aromatherapy, what exactly is clinical aromatherapy? Aromatherapy is the use of essential oils for therapeutic purposes, where you want healing to occur, right. It is an ancient treatment for physical like arthritis, migraines, etc., and mental disorders like stress, depression, anxiety, which allows us to benefit from the therapeutic chemical properties of the essential oil. Now, just yesterday I was moving about in my own town, and I saw a cycle rickshaw with a hoarding with a big board. They were selling some massage oil for treatment of pain. And then there was this fellow who was sitting on the rickshaw, and with a loudspeaker he was announcing that, come please buy my massage oil, and people were buying it. So, earlier I used to look at it and laugh basically, but now I do not laugh anymore, because I went ahead and I saw the constituents of that oil which they were actually selling. And among the constituents there were so many compounds like peppermint oil, eucalyptus oil, clove oil, which all are essential oils, and they actually help in relieving pain. So, whatever they are doing is not just a humbug, right. So, that was our ancient tradition. Essential oils have been used in the past in our country also, and they have been used extensively. People are still using it, and we use it daily, even daily like in the evenings or in the mornings, whenever you do a puja or you light up an agarbatti, that is an incense stick. It is a type of aromatherapy only. It makes you feel good, it helps you connect with divinity. So, that is the power of aromatherapy. You use it daily, we all use it daily, but when it comes to a scientific bend of mind, we usually call it a humbug. So, that is not exactly done. Clinical aromatherapy is not meant to replace medical advice or care, but rather to complement it. The National Association for Holistic Aromatherapy defines essential oil therapy as the art and science of utilizing naturally extracted aromatic essences from plants to balance, harmonize and promote the health of body and mind. So, here you are not only treating the body, but you are also treating the mind. So, it is a holistic approach to healing. Aromatherapy uses the sense of smell for healing and exposes one to an ideal olfactory environment. It works on the Shukshma Sharira. If you go to Vedanta, they call it our whole body is actually our, not body, I would call it existence, is made of Sharira Traya, that is 3 types of Sharir are there. One is the Sthula Sharir, this is the physical body. Second is the Sukshma Sharir, which is a subtle body, that is which is made like your mind. Can you feel your mind? You cannot feel your mind. The mind does not have a physical existence, but yet it is there, we understand it every day. So, Man, Buddhi, Chitta and Ahankar, the mind, your intelligence, ego, these all constitute the Shukshma Sharir, and then is the Karana Sharir, the third one, which is basically the soul, your Atma. So, aromatherapy is supposed to work on the Shukshma Sharir, on the subtle body, and it also works through the chakras and nadis, the various chakra systems and the nadis, the various energy channels as described. I will not go into the details of that, because that would be perhaps covered in later lectures. Now, coming to scientific evidences, massage and aromatherapy, this study was a 2018 study. Massage and aromatherapy are being used increasingly by nurses to enhance the well-being of patients in palliative care settings, yet little evaluation of these therapies have been undertaken. So, in this particular study, they compared the effects of a 8-week course of massage with or without the addition of blend of essential oils on patients undergoing cancer treatment. So, patients undergoing cancer treatment divided into 2 groups, one standard massage, second group essential oils were used in the massage, and findings suggested that massage has a significant effect on anxiety, and this was found to be greater when essential oils were used. That means, massage combined with essential oils resulted in greater benefit, although the sample size was small. So, massage was reported to be universally beneficial by patients, as it assisted in relaxation and reduced physical and emotional symptoms. Another study, and this again showed, basically they did the measurements used in this particular study, assess the anxiety level of patients as well. And here the response to the post therapy questionnaire indicate that patients considered the massage or aromatherapy to be beneficial in reducing anxiety, tension, pain and depression. So, again another study which actually showed that aromatherapy would actually help us in reduction of anxiety, tension, pain and depression. Now, another research where sampling of essential oils and their effects on common symptoms were done. Respondents rated the essential oil on a 0 to 10 scale, right. So, which essential oil actually produced benefit? So, like sweet marjoram reduced pain by 3 points. There was a 27% reduction in pain. Other essential oils which actually help to reduce pain is the oil of wintergreen, right, and black pepper oil can also help to reduce pain. Cloves, clove oil can help to reduce pain. Ginger reduced nausea by 2 points. There was a 18% reduction in nausea by ginger. And this is these are very common home remedies also. We chew on a small bit of ginger, and if you are feeling nauseous. Lavender and marjoram reduced anxiety by 2 points. There was a 18% reduction. So, definitely these studies do show that it works, right. So, this is these are the leaves of sweet marjoram, and they help in reducing pain. Now, there was another study which was quite interesting, and this was done in the United States. The research question was, does diffusing essential oils that promote relaxation and balance affect the nursing staff's stress level? So, nurses in the pre-operative holding area, before the patient is taken for surgery, there is a pre-operative holding area. So, the nurses who were monitoring those pre-operative holding area, 33 nurses were taken for the study. They completed a pre-survey in the 2 weeks before intervention was started. So, pre-survey was done, then nebulizing diffusers were used at the nurses station for aromatherapy over the next 4 weeks, and all essential oils used were citrus based like orange, bergamot and all, and single oil blends were not used. The scents included lime, wild orange, grapefruit, tangerine, lemon and so on, and this was the result. So, you can see here this was the baseline. So, baseline the stress level, perceived stress score scale was quite high, right. So, here it was almost 17 or 18 baseline before the study. Once aromatherapy was started, at that time the stress level came down to below 15, right, and in the follow up also the stress level remained low in the nurses. So, aromatherapy actually helped to reduce the stress of these nurses. And another study was done for palliative care nurses, because palliative care physicians and nurses deal with death and dying every day, terminally ill patients. So, it is a very difficult time that they go through. So, in the palliative care nurses, a blend of wood, frankincense, blue tansy, blue chamomile and spruce, which basically had grounding and balancing qualities, were used. And the work stress level, the red is before therapy and the blue is after therapy, there was a reduction. Personal stress level also reduced, overwhelming sense also reduced, negative mood also reduced. So, definitely the aromatherapy helped them. But then of course, there were other studies also which basically concluded that compared with common massage alone, aromatherapy massage does not provide significant effectiveness of anxiety improvement among patients receiving palliative care. So, there were studies which actually said that they are helpful, and then there are studies which says that perhaps they are not very helpful. So, very very confusing evidences. So, coming back to essential oils as discussed before in my previous lectures also, they are concentrated substances obtained from aromatic plants found in the flowers, leaves, bark, wood, roots, seeds or even the peels of plants. So, coming to the history, evidence found that archaeology digs give proof as early as 60,000 years, where in the Papyrus Eber manuscript found in Egypt listed myrtle, frankincense and myrrh for hay fever. Hippocrates in 450 BC, the father of medicine, used 200 to 300 herbs and aromatic baths to treat others. He wrote, "The road to good health is paved with a daily aromatic bath and massage." He also wrote, "In order to cure the human body, it is necessary to first have knowledge of the whole." The whole means the whole human. We are not just the body. So, as a person as a whole. And then Florence Nightingale used to place drops of lavender on the foreheads of soldiers to help them sleep. This is Florence Nightingale, and those soldiers, this is where she started off with the whole concept of nursing. Placing, now lavender is an excellent aromatic oil which has anxiolytic properties, it has immune boosting properties, right. It has got antidepressant properties, it has anti-cancer properties. So, it has got multiple uses. And then, as I said before also, it was Rene Maurice Gattefossé, known as the father of aromatherapy, who was a French perfume chemist, who in 1910 had an explosion in his lab, burnt his entire arm and ran to immerse it in lavender water. Pain and redness decreased immediately. He was so amazed at the healing properties of aromatic plants that he devoted his whole life to this study and called it aromatherapy. In England, midwives and nurses created clinical aromatherapy, where external use of essential oils to treat various clinical conditions. So, now coming to clinical aromatherapy, it is used for specific therapeutic purposes with measurable outcomes. It enhances the well-being, promotes relaxation, promotes sleep, reduces stress, decrease or relieve physical symptoms such as nausea, headache, pain, decrease symptoms related to an emotional and spiritual distress, and promotes a pleasant smelling environment. What more do you want? So, again, continuing with the benefits of essential oils, they potentially avoid negative side effects of medications, promote relaxation, physical and psychological well-being. They benefit informal caregivers or family members or loved ones to reduce a wide range of emotions related to overwhelming guilt, fatigue and inhibitory grief or loss issues. Because see, it is not only the patient who is suffering. In long term illness like say cancer or any such chronic illness like chronic renal failure, chronic heart failure, it is not only the patient who is suffering, the whole family is suffering, and often we do not look at the family. It is important that we look at the family members also, and with aromatherapy this is a very easy and a very pleasant way in which the various issues of the family members can also be tackled. It allows for a more holistic care. It potentially reduces polypharmacy as well as use of narcotics and psychotropic medications, allows for more tailored care and increased touch. Now, touch is a very, very important aspect of care. You know, touching a human being, acknowledging the human being as a human being. Nowadays, with the advent of technology, we hardly talk to each other. We talk to others using WhatsApp. We are not comfortable with sitting with a person right in front of us and talking to them, because we are more comfortable that we will write in WhatsApp, we will have a chat on WhatsApp, or we will have a video chatting. But we have lost this very sense that we should actually sit in front physically in front of a person and talk to him. And our children are also following the same suit. They spend lonely times locked up in their own rooms and chatting or playing games on mobiles and computers. So, that human touch, that human interaction, man to man interaction, that is somehow missing, and it comes as no wonder that there is a alienation of the whole system, right. Essential oils promote a more positive experience in the dyeing process. It helps to reduce the odors. That if you have ever sat with a dying person or with a dead body, there is a heavy smell around in the room, right, or even a dying person, there is a heavy smell in the room which is not very pleasant. But if you use aromatherapy in the room, that heavy smell can go away and you would have a more calming environment, a stress free environment you can have. So, aromatherapy can be used, dead doulas can actually use aromatherapy. I also have founded the International Dead Doula Association of India, and we use aromatherapy extensively while staying vigil with the dying patients. So, now coming to some essential oils like mints, these are primarily energizing, like spearmint or wintergreen. Wintergreen oil is also used for pain relief. Like then there is a citrus group which is uplifting, like tangerine, lemon. So, whenever your mood is down, you want an uplift of mood, you can have some lemon flavors or tangerine flavor. Spices, these are warming, grounding, soothing, right. So, especially if you have the Vata dosh or the Kapha dosh also, there you can use myrrh, clary sage, clove. Herbs and grasses, these are warming, energizing, renewing, like spikenard, thyme, rosemary. Trees like the eucalyptus, cedar wood and cypress, these have grounding and soothing effects. Florals, these are calming, like lavender, geranium, ylang ylang. Ylang ylang is used in depression also. Lavender is also very good for depression, it is very good for insomnia. So, a beginner's guide to essential oils, how to use them. So, whenever you are going to use essential oils, you need to have a very calming environment. You cannot use essential oils in a very busy place. You need to have a very calm, quiet environment. Remember to switch off your mobiles, talk gently with the patient, the lighting should be soft, right. And then you use a diffuser. If you do not have a diffuser, you can use a cotton ball in which you put 1 or 2 drops of the essential oil, or you can use an aroma stick, right. And then you start aromatherapy. So, the whole environment should be attuned, so that the patient can use their senses directed to the aromatherapy, only then it will work. So, lavender, these are monoterphenol, these have antimicrobial properties, they are safe, gentle, effective, works well for insomnia, stress, anxiety, pain. Lavender is very expensive. You can use clary sage as an alternative. Then sweet orange is a monoterpene, the citrus peels and needle trees, they have decongestant and antispasmodic effect, especially if somebody has period pains or cramps in the stomach, then you can use sweet orange, or and the alternative is mandarin oil. Then comes Roman chamomile, which is an ester, it has got relaxing effects on CNS, it is spasmolytic, used for insomnia. Somebody with epilepsy would benefit from Roman chamomile. It has got antimicrobial properties. Oil of bergamot is a alternative to Roman chamomile. Then peppermint, these are ketone derivatives and they are very good expectorants, analgesic, antispasmodic again. They are very good for chronic bronchitis, for infections like rosemary oil, right. Then comes eucalyptus, which is an aldehyde, it has got antiviral, anti-inflammatory properties. So, for wounds and all, alternative is Ravinsara oil. Then tea tree, which is an oxide, it has got antiviral and expectorant properties. It is a heal all remedy, you can blend tea tree oil with different other essential oils. Frankincense, again this is quite expensive, this is a sesquiterphenol, it is revitalizing and regenerative properties, and alternative would be sandalwood oil. So, there was some research done with the use of essential oils in dementia. Early crossover study in 9 patients demonstrated increased duration of sleep, especially if you are using lavender and all, no, then this helps quite a lot. Later, single case study of 4 insomniac psychogeriatric patients with dementia suggested lavender oil was as effective in controlling poor sleep patterns as was their usual long term drug treatment, like using benzodiazepines. So, this is a good substitute, right. That does not mean that you stop benzodiazepine suddenly, because they can have a rebound effect. But then definitely lavender oil has so many beautiful properties. Lavender was also found effective in severe dementia patients to improve sleep. So, how to use essential oils, as I said before also, you need to have a use of healing tone environment, a quiet calming environment, soft lights, no disturbances, assess the pain and or anxiety level of the patient. So, before therapy and after therapy, assess the level of pain or anxiety before therapy. You can use a simple 10-point scale, from 0 to 10. You can prepare 1 to 2 drops of essential oil on cotton ball and place it in a medicine cup, or use of aroma dove to place at the bedside. I personally use a diffuser. These diffusers are available in the market and very effective, and instruct the patient to inhale slowly deeply through the nose for 3 to 5 minutes. We are here to promote healing. Our aim is not just treatment. Healing comes from the word helen, meaning to make whole. We are restoring the wholeness of a person, the physical, psychological, social and spiritual aspects of the patient. We are restoring it, we are making the person whole again. healing is not the same as curing. Healing occurs when there is a reduction in stress and anxiety, which in turn positively impacts our bodies in so many ways, right. So, the goal is harmony of the mind, body and the spirit, which is holistic. So, healing environment means a calm, nurturing environment, reduced lighting, temperature should be adjusted for comfort, quiet or pleasant music and images. So, you can use multiple therapies together, like the touch therapy, music therapy, art therapy along with aromatherapy. Smiling, a calming soothing voice, language, use of proper suggestions in our words, maintain eye contact, the body language, your body language should be very receptive, right, an open type of body language, sitting face to face, which gives the illusion that you are there for a longer period of time, and touch, gently placing your hand on the patient, but touch should be culturally appropriate. That is very important, right. It should be culturally appropriate touch, and reassess frequently by asking very simple questions like, can I do anything to help you feel more comfortable? So, simple questions. And this is one of the books which I have written, because I also work on food, healing and so many other things, and the amount of contribution that food and aromas have on the power of healing is basically displayed out in this book. Well, that is all for now. Thank you.